Rescuers in Afghanistan have not given up in their search for survivors 4 days after an earthquake struck the nation's eastern provinces.
Taliban officials say more than 1,400 people have died. Many survivors are still waiting for aid as rescuers navigate harsh weather and rugged terrain to reach isolated areas. Narrow mountainous roads leading to remote hamlets have been damaged in the quake or are covered by landslides, blocking vehicle access. A UN agency warned that food aid for victims could run out in 4 weeks without urgent funding from other countries.
The magnitude 6 quake struck eastern provinces of Kunar and Nangarhar close to midnight on Sunday, crumbling thousands of homes. A second quake of magnitude 5.5 hit on Tuesday evening as well, which interrupted rescue efforts. And for more on how Afghan authorities and the international community are responding to the situation, we join now by Afrhill Rances, who's Regional Communications Manager at the IFRC, live from Kuala Lumpur. Afrhill, thank you very much for joining us. I get a sense that, we do have information coming in from the wires, but I have a sense that they are a little bit outdated. Can you update us on what the accurate picture is right now from the affected provinces in Afghanistan?
Thank you so much for having me. So the situation remains critical in Kunar and Nangarhar provinces, the most impacted areas, with now over 1,500 people reported dead and more than 3,000 injured. So as the IFRC, we are working very closely with our partner, Afghan Red Crescent Society, who has been there in those affected areas within the hours after the earthquake. We fear that these numbers will continue to rise as the search and rescue efforts continue, and it's been 4 days since the earthquake happened. So our colleagues from the Afghan Red Crescent teams, staff and volunteers together are working tirelessly to help those who were affected. And as you showed in the picture, that landslides have blocked access to remote villages like Mazar Dara, some of them requiring helicopter evacuations. And in the previous reports, that also says health facilities are continuously overwhelmed, where thousands remain displaced. In fact, one of our ARCS volunteers, he lost 9 members of his family, and yet he was forced, of course, to drag them out of the rubble, as what we heard from our colleagues on the ground.
Afrhill, as these efforts to rescue and search for people continue, we are also hearing that aid agencies have been urging the international community to send more aids. So what's the problem right now? Why is there reluctance or hesitation to do so?
So right now, through the joint effort of Afghan Red Crescent and the IFRC, where we in fact just launched an emergency appeal amounting to 25 million francs, aid is being mobilized, but the damaged roads and landslides are major barriers. Helicopter evacuations and food access are being used where it's possible. We actually also have prepositioned stocks in Kabul warehouse, good for 5,000 families, but transporting them to those remote areas remain a very difficult logistical challenge. So that remains the issue in terms of how aid will be brought in those affected areas.
We're also reading about limited aid pledges and emergency funding because of Afghanistan's current geopolitical standing. In your opinion, should there perhaps be exceptions made when it comes to humanitarian disasters like such, instead of political barriers dictating how a country should be helped? I mean, these are the consequences of a lack of attention, a slow response even to those rescue efforts.
Thank you. So even before the change in leadership that took place 4 years ago, the IFRC has been working with the Afghan Red Crescent through and through in close coordination with authorities to ensure complementarity, alignment of priorities, and effective response to the affected population. So the International Red Cross and Red Crescent movement, I also refer to the ICRC, and our partner national societies on the ground have been backing up Afghan Red Crescent Society to deliver aid to those who are most in need. We are also guided by our fundamental principles such as neutrality and impartiality, so that whatever crisis or issue, whether it's geopolitical or socioeconomic, we are able to deliver aid to those who need it the most.
Yeah, Afghanistan is a highly conservative country with strict restrictions on women And there are now fears that women may not get timely aid because there are reports that, injured women, they're not able to get the treatment they need due to a lack of female doctors. I mean, how does this, the nature of the country's culture, how does this hamper rescue operations and treatment? Tell us about some of the sensitivities that rescuers will have to navigate. And, in broader scheme of things, how much further could this quake set women in Afghanistan back by?
Thank you. I think this also somewhat relates to the previous answer that I gave you, in the sense that the Afghan Red Crescent Society has unique access to people in need. So as I mentioned, recognized for its neutrality, impartiality, and independence, the ARCS has been able to help people living in those difficult to reach areas, including women, men, boys, and girls. So as a local actor, our staff and volunteers are working in every province across the country, even before the earthquake happened. Now, in terms of having women access, especially the critical treatment that they need, especially those who were injured right after the earthquake, we are aware of such challenges, especially when it comes to accessing medical care. There is a limited availability of female health professionals in some areas. And like you mentioned, in terms of cultural sensitivities, like the Kunar province that was really impacted, is a highly conservative area. So in our operations, we ensure and we are committed to inclusive and culturally sensitive service delivery. So Afghan Red Crescent teams, including have female staff such as midwives and healthcare workers, because we understand that specifically for healthcare and education interventions, these require female to female interventions and implementation on the ground. So these gender sensitivities, while they are highly sensitive and in some areas conservative, it does not necessarily stop us to reach those who need it the most. So that's why we make sure that we get to mobilize as much as possible female staff and volunteers as well.
Okay, I hear you. I hear what you're saying, Afrhill, in terms of your efforts and being neutral and treating everyone equally, but the reality on the ground, I mean, how do you ensure this actually happens? The aid gets to the communities and to the people who need them, because we still hear reports about those restrictions we talked about and also interference with NGO operations.
Correct. It's there has been reports, especially in the early days after the earthquake. So our teams, in reality, how they navigate those challenges is working closely with the communities and authorities, and like I said, deploying female staff where possible. So for example, now I think we have at least 4 or 5 what we call mobile health teams. So those mobile health teams, as what we call, they have women health staff such as volunteers, nurses, midwives who can provide at least the basic care. But of course, those who have serious cases need to be referred to hospitals. But then again, the Nangarhar Province Provincial Hospital is also badly impacted by the earthquake. So we're really trying to do our best in terms of the overall coordination within the international community and those organizations within Afghanistan to make sure that we get to provide the assistance as swift as possible, despite, like what I mentioned, the logistical challenges and being able to reach the women and children especially.
Right. Afrhill, just want to ask you about what the UN flagged earlier today about the presence of mines and other explosive ordnance. I mean, is that really serious? I mean, how are you making sure your staff are safe, as they try to reach all these, affected communities and villages?
Correct. So even before any disaster, the IFRC also provides training to the national societies, in this case, the Afghan Red Crescent, to make sure that they are properly briefed when it comes to their security and safety. And also, of course, we have our do no harm policy in place to make sure that staff and volunteers are properly informed and oriented when it comes to ensuring their safety more than anything. But like what I mentioned, for example, one of these ARCS volunteers who lost 9 family members, I think in such cases where you really do not have a choice but to drag themselves out of the rubble, and of course he had to be assisted by the local staff on the ground to make sure that he also does it safely, despite, of course, the very unfortunate situation and distress that the volunteer is going through.
Understood. Afrhill, we do have to leave it there for now. We thank you so much for talking to us. Afrhill Rances, as Regional Communications Manager at the IFRC, talking to us live from Kuala Lumpur.